Welcome. Here are 10 practical tips for healthcare providers to prevent chronic Lyme disease. First, Lyme disease is primarily a clinical diagnosis. While laboratory tests, like the two-tier approach of ELISA followed by a Western blot, can provide valuable support, Lyme disease diagnosis hinges on clinical judgment. The disease's early symptoms, such as the classic erythema migra rash, fever, and joint pain, often present before the immune system has generated detectable antibodies. This means that the diagnosis is often made based on clinical presentation, particularly in endemic areas, even if the tests are negative. 2. Early treatment can prevent complications. The importance of early treatment in Lyme disease cannot be overstated. Studies have consistently shown that when antibiotics are administered promptly, ideally within weeks of infection, they can prevent the progression to more serious complications, such as Lyme arthritis, neuroborreliosis, and Lyme carditis. The windows for optimal intervention is narrow, making early recognition and treatment vital. 3. Co-infections are common and complicate the picture. Ticks don't just carry Borrelia burgdorferi, they also transmit other pathogens like Babesia microti, Bartonella hemsili, and Anaplasmosis phagocytilium. These co-infections can lead to overlapping or more severe symptoms and may require different or additional treatments. Research indicates that co-infections are present in up to 30% of Lyme disease cases, which underscores the importance of considering a broad differential diagnosis when symptoms persist. 4. Lyme disease can mimic a range of other conditions. Known as the great imitator, Lyme disease can present with symptoms that resemble those of multiple sclerosis, rheumatoid arthritis, fibromyalgia, or chronic fatigue syndrome. This mimicry can lead to misdiagnosis, delaying proper treatment. It's crucial for healthcare providers to consider Lyme disease in their differential diagnosis, especially in patients with a history of tick exposure. 5. Seronegative Lyme disease is a real and recognized phenomenon. Not all patients with Lyme disease will test positive on standard serologic tests, especially in the early stages or if they are received early antibiotic treatment. This phenomenon, known as seronegative Lyme disease, can make diagnosis challenging. Cases may be seronegative, which requires healthcare providers to rely on their clinical instincts and patient history. 6. Post-treatment Lyme disease syndrome, also called PTLDS, requires attention. PTLDS, affecting 10 to 20% of Lyme disease patients, presents a significant challenge. Symptoms such as fatigue, pain, and cognitive difficulties persist long after the infection should have been cleared. The exact cause of PTLDS is still debated, with theories ranging from persistent infection to autoimmune dysfunction. What is clear, however, is that these patients need careful management and support rather than dismissal. 7. Prevention through tick avoidance is key. Preventing tick bites is the most effective strategy to avoid Lyme disease and its associated complications. This includes the use of insect repellents, wearing protective clothing, performing regular tick checks, and removing ticks promptly. Education about these preventive measures is essential, particularly in areas where Lyme disease is endemic. 8. Rash is not always present, but is a strong indicator. The erythema migra rash, while characteristic of Lyme disease, is not always present. Patients may not develop this rash, or they might not notice if it appears in less visible areas. However, when present, the rash is a strong indicator of Lyme disease and should prompt immediate treatment. 9. Lyme disease is expanding beyond traditional regions. Although Lyme disease is most commonly associated with the northeastern and upper Midwestern states, its geographical range is expanding. Climate change, shifting tick populations, and changing land use patterns are contributing to the spread of Lyme disease into areas previously considered non-endemic. Healthcare providers need to be aware of this trend and consider Lyme disease even in regions where it was once rare. 10. Lyme disease can affect multiple organ systems. Lyme disease is a multisystemic illness that can impact various parts of the body, including the joints, heart, and nervous system. Its ability to cause a wide range of symptoms, from arthritis to neurologic issues like memory loss and neuropathy, means that it requires a comprehensive approach to diagnosis and treatment. Understanding the disease's potential to affect multiple systems helps in managing its diverse presentations. These insights highlight the complexities of Lyme disease and the importance of a nuanced, patient-centered approach to its diagnosis and management.